Hi everyone, I wanted to take a minute as we open up this week's module, being module 14, to let you all know that I've decided to make a couple of little changes as we round out this semester. For one, today we're not going to be talking about integrated behavioral health. As you'll see in the module, kind of switch things around a little bit, and so I want and this is kind of as a result of looking at everybody's discussion posts, and it seems as if everybody's leaning towards or kind of moving into the realm of considering an integrative approach to your theoretical orientation. And that's fine. I'm glad to see that. But I thought that we would take some time to really dig into the chapter that Corey provides in the text, which is good, of course, because he wrote an entire book technically on an integrative perspective in counseling. And so I provided an article that the ACA has on their website from Corey about the book, essentially, and integrative approaches to counseling. But because it seemed like everybody was kind of going in that route anyway, I wanted to make sure that you all are truly approaching the integrative perspective in the way that you should be, rather than it being just kind of a hodgepodge of, I think I like this and this and this and this, and I'm going to pull from every technique in the book while I'm doing counseling and practicum and internships. So I wanted to dedicate some time to that. Also, instead of a discussion post this week, I do want to get you all in the mindset of paper. So I'm going to switch things up, and so there won't be a final exam. I would like for you to start thinking about your theoretical orientation. The paper itself is not going to be that different from what you submitted in terms of the rubric and the assignment requirements in the 501 class. What will be different, I suspect, is the actual content that you include in the paper, and that's why I really think that the paper is well suited for 606 versus 505, or 501, sorry. So because of that, because I want you to start thinking about the theoretical orientation paper prior to Thanksgiving break, this week I want you to do just kind of a reflective journal. So I want you to just start getting into the mindset of what you think your theoretical orientations will be. The journals are just for me to see, and so you don't have to worry about commenting on anybody else's stuff as you move through the week. I feel like if you're anything like me, you're ready for a break, you're ready for Thanksgiving, you need some time off. It's been a whirlwind of a month, I think, in terms of assignments and things that have been due for you guys, the role plays and the videos and all of that. And so hopefully the reflection journal will take a little bit of pressure and stress off of what is due this week, and allow you to really kind of think about, where you are in the class, which theories you have really been drawn to, what you like, what you don't like about it, what you need to know about the theoretical orientations in order to begin practicing using them with real people in your practical experiences. So another note, yes, I've got your videos. Thank you all for submitting them. My apologies for not getting you feedback yet. I'm just going to be providing feedback in the rubric, no video feedback from me this time for your third video. And hopefully I'll be getting those done sooner than later, or if you're watching this later in the week, ideally I've gotten them done and you don't have to, you can just disregard all of this. For your fourth video, because it's the final video, I am hoping that I can get scheduled with all of you, especially since it's a smaller class, some dedicated time to talk, to provide my feedback. Dustin, we might have to do something a little bit different, but ideally I'd like to do it like over Zoom, or if you're in Morgantown, we can do that in person, or just on the phone, whatever modality works best. But I'd like to provide the feedback in that way, in a real-time way, so that you can get all the feedback you need before you get into, practicum, or before you take a little bit of a break before you start your practicum later on. And I think we have time to do that, especially since the videos are due like on the 5th of December, and class doesn't close until the 18th. So and hopefully with the video being due after Thanksgiving break, you guys will have plenty of time to get those scheduled and get them done and completed, potentially over the break or, right afterwards. So we really are rounding things out, again, talking about integrative perspectives this week, and, kind of wrapping everything up with multicultural theories after a break. Positive psychology, I might go ahead and combine positive psychology and integrated behavioral health for that last module. simply because we've really kind of talked about positive psychology. We talked about it in 501, you had it a little bit in the Corey text as well. So I don't want to kind of beat a dead horse with positive psychology or a unicorn. I always think of positive psychology as like a unicorn pooping rainbows. So hopefully I can get you a good amount of supplemental information on integrated behavioral health. Probably be bringing in Dr. Glenn for a little bit of that information content, since that's her, definitely an area of expertise of hers. So hopefully not a lot of confusion with me changing things here at the end, but let's just roll with it as we go along. And I appreciate the patience and all the feedback, really, because I want to make sure that you guys are getting what you need from me as we finish up this your final theories and techniques class. So with that, let's go ahead and jump into integrated perspectives. So we're looking at chapter 15 now. And when we think about integrated perspectives, I mean, really, more recent studies have indicated that counselors are doing this. By and large, the vast majority of counselors are using an integrative approach. But what this doesn't mean is that counselors are using that like bad term eclectic, which I hate to say it's a bad term, but whenever I've heard of a counselor or a student, that says, I'm eclectic in my approaches, it just makes me cringe. And I just want to say, tell me in a very detailed way what you mean when you say eclectic, because you'll hear what Corey talks about it, and Dr. Kotler in the video that hopefully, God willing, will work for you guys, talk about eclectic approaches as people just kind of picking out of a basket with no rhyme or reason, specific techniques that they think that they like or they think that will work and they don't. And so eclectic has gotten a bad rap, and there's a negative connotation with that terminology. But when we're thinking about psychotherapy integration and integration of counseling theories, techniques, whichever it might be, there are specific dedicated approaches to being integrated. And so we briefly talked about these when you guys were in the immersive week, but wow, that was yesterday, right? So I expect that you remember all of it. So Corey provides a nice review of that, and I'll do the same as well. So there are four main approaches to integration, the first being technical integration. And so this is where we're looking at our client, we're looking at our clientele, we're coming into us, and we're thinking about the best treatment techniques, the best theoretical approaches, the best techniques that will work for the person sitting across from us, or virtually sitting across from us, if you will. So we're not necessarily subscribing strictly to one approach, but we're purposefully selecting treatment techniques. So this is where that technical eclecticism term is okay, because again, we are looking at our paper, the papers were given an intake, we're talking to our client, we realize that they have X diagnosis, we know that certain theoretical approaches, certain techniques work better for individuals with that diagnosis. Just going to throw out like anxiety and depression. We know pretty concretely CBT works very well as a treatment technique for individuals that experience anxiety and depression. And so me as a counselor, maybe I would say, okay, this client is exhibiting those symptoms, has that diagnosis, or I'm providing the diagnosis, and so therefore I'm going to start using some of the CBT techniques. So you're well informed with this approach, so you're not just pulling from different techniques or that you are not used to using or you haven't used in the past, or if you're trying things out, you're making sure you're doing it in an ethical way and getting supervision so that your client knows that they're kind of the test subject, more or less, for using these techniques, but they're okay with that, and they're providing you with feedback so that you're able to practice the techniques that you're using. So that's just a note to say about integration in general, which is kind of deviating from the slides here. But if we're thinking about new approaches, new theoretical approaches, new techniques, new counseling techniques that come out, which they do, and that's okay, that's part of the process of counseling and psychotherapy, is that we learn from the past, we learn from the approaches that are out there, we continue to do research, we continue to build upon the evidence-based practices that we have, and so at some point some clinician out there has to be trying out these techniques to see if they actually work, and they have to try them on actual people. And so one of the things that we have to do in those cases is we're probably going to be using an integrative approach, right? We're going to be using stuff that has that theoretical basis, that has that evidence-based practice support within the research and literature, but maybe we're trying something new out because we went to ACA and whatever cool place they decided to have the conference, and they taught us about this really neat technique. But we're letting our clients know about this. We're letting our clients know why we're using these new techniques, any kind of evidence-based support for the effectiveness of the technique, and we're always allowing our clients to provide feedback and opt out. We're allowing them to say, no, I don't like that weird thing you're doing right now. Let's go back to what you know. So we're giving our clients that autonomy and control over the process to ensure that we're remaining ethical in our practices. Now back to the slides. So approach number 2, theoretical integration. And so basically this is where we are integrating underlying theories of therapy along with the techniques from each. Examples of this, so basically we're taking, typically I would say like 2 to 3 theoretical orientations, right? Because if we start getting more, then we're just pulling from a bag. So we're taking like solution-focused brief therapy plus person-centered. We're kind of integrating both of those, and we're doing it both on a conceptual basis and a blending of techniques. So it's kind of everything. And so an example of this would be like DBT, dialectical behavioral therapy, where we're taking behavioral theories, behavioral therapy and techniques, combining it with psychoanalytic theories and techniques. Voila, we've got DBT, which works great for people with borderline personality disorder, right? And so other examples, acceptance and commitment therapy, motion-focused therapy. So there have been some dedicated approaches that have emerged because of theoretical integration, and those newer approaches like DBT, ACT, EFT are now gaining more and more empirical support for the use of those approaches. So that's kind of where integration can go. Again, when you're doing it purposefully and in the right way, good things can come about from it. Approach number 3, assimilative integration. So this is where you yourself as the clinician, as the counselor, you're grounded in a particular school of thought. There's one theory that just speaks to you more than any other theory. Maybe it's feminist therapies, maybe it's feminist theory, maybe it's multicultural theories, maybe it's the behavioral theories, whatever it might be. There's just one that you you have all the books for, you've had the authors sign your books, and you just, you know, you've got Freud's picture up in your office, whatever. So there's one approach, right? But then you know that it's not a one-size-fits-all process, and there are other pieces of other approaches that you kind of like too. So you may be assimilating different theoretical approaches. So you've got kind of example of mindfulness-based cognitive therapy, and really any of those other cognitive therapies that pull from different aspects like trauma-informed cognitive behavioral therapy, mindfulness-based cognitive behavioral therapy. Clinicians, counselors are grounded in the cognitive behavioral therapies. They are grounded in that therapeutic approach, but they're pulling tiny little pieces from other practices. Another example of this is Dr. Kotler in the video. You'll see that, well, maybe you will or won't, because I'm telling you to watch the role play part of it, the part where he's with the client, but I encourage you to continue watching as he provides a synopsis of the session, things that he did, why he did them, and there's even a question and answer part to the video too that is really useful. But what he says after the video with Harriet is that, you know, he's existential all the way, that he's grounded in existentialism. Or Adlerian is what the moderators say, but he's pulling these other approaches into the counseling session as part of his way of integrating these therapeutic approaches. And finally, the common factors approach. And so with this approach, it's an acknowledgement that regardless of what theoretical orientation you are grounded in, whichever one speaks to you the most, there are these common factors across the board with every theoretical orientation that every counselor basically just says, yep, we need to be doing these things. So we understand that there are certain causes of behavior, that trauma affects somebody in specific ways. We understand that we need to be empathetic and respectful, that the therapeutic alliance is important. And so all of these things, are facets of each theoretical approach, and so kind of this common factors approach is that we get that, and we emphasize these common elements across the board. So I'm going to just kind of jump to the feedback-informed treatment, which is one of these newer integrated approaches, if you will, but one that I think is gaining a lot of popularity. And this is basically the feedback-informed treatment. It's basically where we're asking our clients to evaluate us continuously, evaluate the counseling services they're being provided. And this to me is taking a client-centered approach to the nth degree here, right? And so in each session, we would be basically putting ourselves out there, asking our clients to provide us with that feedback, and then making modifications because of what they're telling us. If something is not working, they have the freedom to say immediately, this is not working for me, I don't like it. And then you change your approach to the counseling session. I've seen a little bit more of this being taken outside of the counseling room, if you will. So, there's a lot of apps that people use. There's text messages that come through after sessions where you're allowed to rate your counselor to see if you can provide that feedback right then and there as well. And so there are different ways to measure our clients, to measure how effective we are being with our clients in the moment, more or less. So this approach, I do like feedback-informed treatment, and especially for newer counselors. It's very uncomfortable to be asking somebody, especially somebody that's effectively a stranger, in a first session, what they think of us, what they think of the work that we're doing. But it's really necessary because, again, anytime we're working with somebody, we're asking, again, a stranger to come in, divulge secrets, essentially, tell us the issues that are going on with their life that they may not have told the people they are closest to outside of a counseling session. So we're asking a lot of our clients, and so to me it makes sense that we put ourselves in the hot seat and make sure that we're providing quality care to our clients who are coming to us really for serious issues to get some assistance. There's also something that Dr. Kotler says in the video that I would mirror, and that is, within practicum and internship experiences specifically, you can find yourself as a newer counselor getting into the habit of using the same techniques, and then you kind of put blinders up to how effective they are. And so you may be, using a scaling question over and over and over for a client, and as an outsider, as somebody that's providing supervision, it can be easy for us to see that, wow, that client has detached themselves. They are not in it right now. This is not an effective technique. It is not working, but it can be harder for you as a novice counselor, especially to be open to see that what you're doing isn't working. It can be hard to be self-critical in the moment, and feedback-informed treatment allows for that. So you have to be okay with the discomfort that it might produce. You have to be open to constructive criticism to a degree, but it can be really helpful for everybody involved and help keep us on track as counselors, help us help our clients to the best that we can, right? So with that, I'm trying to think of anything else that... There's another little video from Alan Ivy. You remember Ivy from your 501 class, right? Again, I hope the video works. We'll see. I provided every different link that I possibly could, including the citation, so you could always look through Alexander Street for integrative counseling to see if hopefully that would pop up and be able to stream for you. I am sure I will hear of the problems. So if you have any questions throughout the week, please let me know. And since I will not see you virtually, have a good holiday break, get some rest, visit with people, turn off the brain for a little bit and enjoy the break. And we'll see you after Thanksgiving break.